Okay, prescription medications. There's lots of these. On the left-hand column is the more traditional medications. They're called anticholinergics or antimuscarinics. The term anti means block. That means this medication blocks something in your bladder. And these block the contraction in your bladder because there's receptors inside your bladder that allow it to fill and then allow it to contract. So if it's contracting too much, let's block that. These are older and they have a bit more side effects. Dry eyes, dry mouth, constipation. But this doesn't sound like that big of a deal, but it prevents most people. About 50% of people will stop taking these medications due to the side effects. And they can cause a little bit of dementia in older folks who are most commonly seeking help for this. And so I don't love these, to be honest. I prefer the newer agents. Beta agonist. Agonist means it induces something, and what it does is it induces relaxation in the bladder. So it functions differently, and because of that, it has decreased side effects. Mirabegron or Myrbetriq and Gemtesa are sort of our go-tos in clinic. We try these the most. I like Gemtesa the best. However, Angelica, my medical assistant, is here. She'll tell you it is just a pain in the tail getting this covered by insurance. It sucks. So I'll give folks samples. They'll love it. I'll try to send it to their pharmacy. It's a no-go. It's $1,000 a month or something. So if you're going to take one thing home from this slide and you want to go ask your primary care for a medication to decrease how frequently you're urinating, if you wanted to start right here, I think that would be pretty safe. On this list, I use Ditropan the most. And these are a lot of times 2 or 3 times a day, but there are some extended release. But the symptoms can be pretty bad. But Myrbetriq is a good place to start if you're sort of, hey, is there anything I can try? There are 2 types of medications for the men who have bladder irritation from big prostate: 5-alpha reductase inhibitors, as well as alpha blockers. A 5-alpha reductase inhibitor, like finasteride, dutasteride, will decrease the size of your prostate by 30% at 6 months. It's the only medication that will literally decrease the size of your prostate without surgery. Alpha blockers act right here on the prostatic urethra and relax this area and allow this passageway to open a little bit more so you can empty better. They do not decrease prostate size. Common alpha blockers. Has anybody here ever taken tamsulosin or Flomax? Don't be shy. It's the most commonly used alpha blocker. It's where I start also. It can lower your blood pressure a tiny bit. 5-alpha reductase, and there's numerous other ones. They're all about the same. I start with Flomax. We like that one the best for some reason. It's tolerated pretty well. 5-alpha reductase inhibitor is the one that decreases your prostate size. Finasteride and dutasteride are the 2 medications that block the conversion of testosterone to DHT. DHT is the little enemy that can also cause male pattern baldness in men. So Propecia is the same thing as Proscar. It's used for prostate as well as for male pattern baldness. A lot of men will ask me, finasteride versus dutasteride, what is the long and short here? Dutasteride blocks both types of 5-alpha reductase, leading to a more significant reduction in DHT. And guess what? Your serum DHT reduces more with dutasteride as well as your scalp DHT. So this can be more effective for prostate symptoms as well as male pattern baldness. So the summary here is dutasteride is theoretically stronger than finasteride. Anybody ever taken saw palmetto for prostate symptoms? It's commonly used. It's a plant. Men will frequently come in and ask me about it. Saw palmetto, along with other nutraceuticals, vitamins, and supplements, have never been shown in any clinical trial to decrease or be effective versus placebo against bladder symptoms or prostate reduction.